Here's a follow-up on a newer type of surgery we've told you about before, the DaVinci robotic surgery device, now in use at Baptist Women's Hospital, is making complicated surgeries easier for doctors to perform and for women to recover. CACHOLA explains why.
Childbirth can be a blessed event, but the aftermath of some births is not so welcome. For women who have had one or more vaginal births, that can lead to the weakening of muscles and connective tissues and allow the uterus to fall out of place. 1 in 9 women will need surgery to fix the problem.
I specialize in pelvic prolapse and incontinence, and actually the #1 procedure, the highest success rate procedure, is actually with the benefit of the robot.
The robot Dr. Vogt is referring to is the DaVinci SI. It's the latest generation of a robotic system that allows doctors a tremendous amount of additional control during surgery. There's already a high rate of success for prolapse repair surgery. Performing it with the aid of the DaVinci has additional benefits for patients, including less pain and quicker recovery.
I'm repairing the problem by putting all the vaginal walls back up in place like they were originally. With prolapse, there's loss of support to the connective tissue, the ligaments, the muscles, and sometimes the nerves are a factor as well.
Instead of a large incision in the abdomen, the robot works through very small incisions. Arms with very small instruments allow probing, cutting, and sewing. Another contains a high-definition camera that offers a close-up, nearly 3-dimensional view of the inside of the pelvic cavity, which adds to the precision of movement by the surgeon.
Again, the visualization is so much improved. There's 3D, it's magnified, and so instead of having to look at the whole area you're working at, you can look at a very specific area.
And because the image from the camera is shown on various screens around the operating room, other members of the surgical team can follow the procedure more closely, instead of trying to look inside the incision where the surgeon is working. With the robot, the surgeon uses hand and foot controls to operate the arms. And because the incisions are so much smaller, the surgery is faster. So is the healing.
What I hear from the patients, a lot will say, I wish I had had the surgery before. Why did I wait so long? The incisions are very small. That way they don't need much pain medicine. They can actually get up and walk the very day of the procedure. They can eat and drink the very day of the procedure. They're often very surprised that they're driving within the first week.
This DaVinci in Baptist Women's Hospital has made gynecological surgery easier for dozens of Mid-South women since being installed earlier this year. For Smart Medicine, I'm LURENE CACHOLA.